This conference will now be recorded.
All right, folks. So I am very appreciative of you all being here tonight. I thank you for coming. This is really our last lecture. Next week we're going to have on Monday, we'll have our practical exam as well as test number 4. And we will also have on Wednesday, our review for the final exam. So the next week that we meet for Wednesday evening, it'll be a review for the final exam. By Sunday night, Monday morning, I'm shooting for Sunday night. I have quite a bit of work to handle and such. So by Sunday night, that's my goal, to get the review for you all as far as the review for the final exam, okay? Know that the urinary system and the reproductive system, that's going to be new material on the final exam. So I think we're looking at like a 60-40. 40% will be new material, 60% will be old material, okay? That's what I'm shooting for. 60-40 is what I believe. You know, it might be anywhere between 60 and 70% old. We'll see what goes on, but usually it's about a 60-40, all depending, you know, so, but that's what I'm looking at, okay? So let's see here. So we're looking at the reproductive system notes. And so for both male and female, I posted this information for you regarding what goes on as far as the terms are gonads, gametes and such. And the gonads, we know, are referring to the ovaries and the testes, right? Producing the gametes, the sex cells, the sperm, and the ovum, right? And so we're going to be talking about, in particular now, female reproductive system. I mentioned to you, and we talked about haploid and diploid already, and knowing also as far as the male reproductive system is concerned. So now let's move on into female reproductive system. And so we had opportunity for, now 2 weeks ago, we looked at the female reproductive system as well as the male as far as the anatomical structures and such. And so here you're seeing as far as these terms that are being shown to you all, and as far as showing you definitions regarding them, we realize that the uterus is where really implantation will occur, as well as development of the fertilized egg, which is the embryo, which is the zygote, which will become the embryo and the fetus, you know, so the progression on into it's going to become a child, right? So you'll see there, as far as that's where that the area where that child is developing. The birth canal would be the vagina, right? And this is where we would have deposition of the sperm, the ejaculate containing the sperm, and we talked about that last week as far as what's contained within that ejaculate, allowing for survival of the sperm, and also allowing for to have smooth muscle contraction take place within the birth canal and such, and allowing for the movement of the sperm to the egg. Recall that I've mentioned to you multiple times that in the uterine tubes, aka the fallopian tubes, aka the oviducts, right? All the same term for these duct system, right? These tubes that fertilization will take place within. Okay. We talked about the gonads here as far as the ovaries are concerned, and I mentioned to you that the gametes, the oocytes, are being produced. They're maturing, and upon ovulation, a ovum will be released once per month. Okay, per the cycle there, and we'll talk about the cycle. And I mentioned it last week there and showed you as far as the image on the note packet here regarding what you really should commit to memory is that chart there. It's very, very, very helpful. As far as the perineum, we talked about last week as far as for the male. And so let's go back for a moment here and just take a look here as far as the male perineum. And let me, if you'll give me just one moment, I apologize. I should have had it queued up here, and because I wanted to talk about luteinizing hormone and FSH as far as for the female reproductive system, and again show you as far as what's going on in the male reproductive system. So let me get to the perineum here for one moment. Here we go. So you'll see here as far as the pubic symphysis, right? You can palpate that. That's just superior to the area there, the private area as far as for the male and female, and your reproductive parts. So that pubic symphysis, that bone, you can palpate that there. You'll see here also that the coccyx and the ischial tuberosity. So this creates an area. It's a an area where we have these structures are located. Now, for the female, you'll see here is that diamond-shaped region between the pubic arch and the coccyx, ischial tuberosities are lateral, and we're going to have different structures being present within. There are many ligaments, and I did not really go over the ligaments in the lab, but I'm just showing you here as far as that these ligaments are what really help to maintain the positioning of the reproductive organs within the female. Okay, so you'll have here the broad ligament, the suspensory ligament, the ovarian ligament. Now, see here as far as the ovarian ligament, so what is this going to attach to? So it extends from the uterus near the attachment of the uterine tube to what? The medial surface of the ovary. So this helps to maintain the ovary. And I believe that I might have showed it to you as far as in the lab, as far as that's concerned, but I didn't ask that you know that for the practical exam. Suspensory ligament, what is this here? So extends from the lateral surface of the ovary past the open end of the uterine tube to the pelvic wall. So again, so we're having here two ligaments connected to the ovaries to keep them in position. And then you'll have here as far as the broad ligament. So this would be really very broad as far as in its size, extensive mesentery that encloses the ovaries, uterine tubes, and the uterus. So it's quite a large structure in comparison to the suspensory and ovarian ligaments, which are more, you would think of tube-shaped as far as the ligaments are concerned, okay? You'll see here, let's see here. So the follicles, so the ovarian follicles. So look at here as far as specialized structures in the cortex of the ovaries where both the oocyte growth and meiosis I occur. As the ovarian cycle, 28-day cycle, and recall that I've said this to you before, and I'm going to show you, I'll come back to this. Okay. And I'm going to reduce the size of this a bit because I want to be able to look at it all in, let's see. Yeah, if I do, here we go. All right, so you're seeing, let's move this up here. Let's go here. And right there. Okay, so what you're going to see here is that here we have the ovarian cycle. So what's going on with the ovum and how then this will be released upon ovulation, and then what's taking place as far as the uterus is concerned. They're coordinating with each other as far as time period within the month. Okay, so you'll see here only 10 to 15% of women have a 28-day cycle. So some will have a little bit less, a little bit more. You know, it all depends, varies. But here's the deal: the follicular phase. So here we have this period of time right here, the beginning of the cycles. Okay, so this area right here, this follicular phase, varies. So this, I said to you that the first half of the cycle can vary, but the second half after ovulation, once ovulation, it's always 14 days. So know that there. So realizing that, you know, whatever's going on as far as how long your cycle may be, whether it's less than or greater than 28 days, know that the beginning portion can vary, but the second half from ovulation on is always 14 days. Okay, so I just wanted to point that out to you all and remind you regarding that. Yeah, here we go. Okay, and so you'll see here as far as the, I'm not going to ask you to give me and to memorize this information here, right? But I want to show you that in the ovarian cycle, what's taking place as far as the ovum is concerned. So we have the oocyte that it's immature, okay? And once upon ovulation, it's going to be mature and ready for fertilization if that's going to take place, okay? So you'll see here that the primordial follicles, primary, secondary, tertiary. So again, this is called the follicular phase. We have these follicular cells that will help to mature the oocyte to become the ovum to be released upon ovulation as luteinizing hormone spikes in its levels. Okay, that's really always important to remember. Luteinizing hormone that spikes at that period of time when ovulation will occur. Okay, so luteinizing hormone spikes, ovulation occurs, the expulsion of the ovum, the egg, takes place and enters into the uterine tubes, the fallopian tubes, the oviducts. Okay. But so you'll see here that you do, I want you to know though, okay, so hence I highlighted it here. So you have primordial follicle, primary, secondary, tertiary. It's the tertiary follicle that will rupture during ovulation. This is what ruptures, this is what releases the egg upon ovulation. Excuse me. And so really this marks the end of ovulation, marks the end of the follicular phase and the beginning of the luteal phase. And so how do you remember this? So you remember that the follicle, this is what's going to help to develop a mature egg and release it upon ovulation when the spiking of luteinizing hormone takes place. And then once the egg is left, all you're left with is the corpus luteum, which will eventually become the corpus albicans. So remember these terms: luteum, albicans, yellow body, white body. And the white body is just, it's the scar tissue that's left, right? But again, too, and I'm not going to go back to the picture again right now, but you have to look at, think of that image of that picture and what's taking place in the follicular and the luteal phase, right? The different phases and what's going on as far as the ovary and the egg is concerned, okay? So the corpus luteum, folks, this is very important. This structure here, it's not just, oh, okay, it's just cells are left after the egg goes and it's not a big deal. No, this is very important because if fertilization does occur, right? So look here. So the empty tertiary follicle initially collapses under luteinizing hormone, right? Luteinizing hormone, corpus luteum, right? So the luteal phase, luteinizing hormones spikes, ovulation occurs, collapses under luteinizing hormone stimulation. The remaining granulose cells proliferate and create the corpus luteum, the yellow body. The corpus luteum, now this is important, secretes progesterone, estrogens. Progesterone prepares the uterus for pregnancy by stimulating the maturation of the uterine lining and secretion of the uterine glands. And so what's going on, folks, is that the corpus luteum is then has the ability to secrete progesterone, estrogens. This is going to help to thicken the endometrium, okay, in preparation for fertilization. Very important, right? So know this, that. Now look here, as far as this corpus albicans. So what happened? What allowed for the luteum to become the albicans? Well, if fertilization doesn't occur after the 12 days, progesterone and estrogen levels fall markedly. And once they drop, folks, once those hormones drop in their levels, then what's going to happen? So then menses begins. Then your cycle begins day one, the bleeding, right? For the first 3 to 5 days, okay? So remember that in these hormones, not only do they have very strong control over what's taking place during these cycles as far as the ovary and the uterus is concerned, but whether they spike or whether they drop dramatically, that also causes changes to take place, okay? Very good. So that's the end of the cycle, and that's the beginning of menstruation as far as the uterus is concerned. Yeah, so here we go as far as the uterus, and we've seen this in the lab, right? As far as looking at the inner lining, the endometrium. This is what actually will slough off during menstruation. And know that, folks, it's not the entire portion of the endometrium, right? This would, and think about it for a moment. Would this make any sense? Because then what would help, how would you rebuild the endometrium each month if you didn't have a portion of it left behind? Makes sense, right? So the myometrium, muscular layer, the perimetrium, this is the visceral peritoneum. This is on the outer surface and the covering of the uterus. Now you'll see here, so this is important. So know that there's a basal layer and a functional layer, right? So the basal layer, and we know this as far as when we're thinking of basal membrane and such, and we know that this is like the bottom layer for when we're thinking of epithelial tissue. So the basal layer, it's the bottom layer. It's unresponsive to hormones, right? Doesn't change. But what does change is the functional layer. So the functional layer changes via hormonal stimulation. And so here's the deal. As a result, each month, that functional layer is what's going to slough off and then be regenerated again. And then you'll see here, as far as vasculature is concerned, so why does this bleeding occur? Because what's going on is that functional layer has a lot of vascularity, okay? So you'll see here that it's the straight, you'll have these, let me step back for a moment here. Arcuate arteries are present in the myometrium, okay, the muscular layer. Radial arteries are present in the endometrium. Now, what are also present are straight and spiral arteries. The spiral arteries are what going to degenerate, okay? And this is what's going to contribute to the blood flow as far as menses is concerned in the beginning of your period of the cycle, of the uterine cycle, day 1. So that spiral arteries in the functional layer degenerate and regenerate each month. Okay, so you need to know these terms as far as arcuate arteries, radial arteries, straight and spiral arteries. Okay. You'll see here that increasing estrogen levels lead to a thickening of the endometrium. And then what will happen is that progesterone levels will also contribute to this as far as the second half of the uterine cycle. Okay, so primarily it's estrogen in the first portion of the uterine cycle, and then it's progesterone in the second half of the uterine cycle. Decreasing progesterone levels cause atrophy of the thick endometrium, so it becomes thin again. And so really, again, like I said to you, that it's the drop in the progesterone levels that begin the first day of the uterine cycle. Let's see here. So FSH, LH, follicle stimulating hormone, luteinizing hormone, stimulate estrogen and progesterone secretion. But then when the levels of estrogen and progesterone get high enough, they inhibit FSH and LH synthesis, which would in turn then not lead to as much of the estrogen and progesterone being secreted. Understood? So it's really FSH and LH contribute to what's going on with the release of estrogen and progesterone. And know that what's contributing to the release of FSH and luteinizing hormone, but gonadotropin releasing hormone from the hypothalamus. And so now let's take this opportunity then to look at this image here let's go back here. So this is from the human biology class in chapter 16 in their PowerPoint. And this would be, yeah, so that's you can see here as far as different structures and such, as far as female reproductive system, just a couple of new images that you can take a look at there. And take a look at this image. This is what I want to show you. So what you're seeing here is that the hypothalamus, right? So the hypothalamus right here, here's the pituitary gland. Hypothalamus releases gonadotropin releasing hormone, sending to the anterior pituitary, which will in turn release FSH and LH. And so here again, just very similar to, a little bit of a different image, but similar to, and it's not showing you the temperature, what's going on, as far as very similar to the image that I posted in your packet there as far as your note packet's concerned. And here also, let's see here. Yeah, so here we go. And so here's another nice image also that you don't have that I'm providing for you all from this text. And you'll see here as far as one of the many immature follicles in an ovary. Each consists of a primary oocyte and the surrounding follicle cells. And again, too, what did we say? The tertiary oocyte, the tertiary follicle is what releases the ovum, the egg, upon ovulation, right? So we have here then, fluid-filled cavity begins to form in the follicle cell layer. You'll see here there's the oocyte, right? Primary oocyte completes meiosis 1 and divides unequally, forming a secondary oocyte and a polar body, which will in turn help to nourish and help to enable the maturation of the ovum. So ovulation occurs, luteinizing hormone spikes, ovulation occurs, rupture of the mature follicle releases a secondary oocyte coated with secreted protein and follicle cells. And so you see here then entering into the fallopian tube, the oviduct, the uterine tube for possible fertilization. And so then you're left with the yellow body, and here's the white body. So the yellow body will continue on and release the hormones and such, and progesterone, estrogen, helping to maintain and thicken the endometrium, right? The functional layer of the endometrium. And in turn, if there's no fertilization that'll take place, then this yellow body will then degenerate and become this white body, the corpus albicans. Okay. Very good. So, I hope that's helpful to you all. We're gonna look at that in a moment there regarding also as far as the STDs are concerned, STIs. Okay. Let's see here. And so here, as far as the ovaries are concerned, follicle stimulating hormone, luteinizing hormone, very important regarding the ovarian cycle. As far as the uterine cycle is concerned, yes, FSH and luteinizing hormone do play a role, but it's primarily estrogen and progesterone, which follicle stimulating hormone, luteinizing hormone contribute to the release of, play the biggest role in how the uterus changes during each cycle. Okay, so you'll see here that estrogen, estradiol is another term for the types of estrogens and such, builds up the lining of the uterus, increases the synthesis of progesterone receptors in the endometrium, thins out normally thick, and this is important, sticky cervical mucus. This thick, sticky cervical mucus will thin and allow then for the passage of the sperm if they are present upon after post-coitus, right? Progesterone increases after an ovary releases an egg, and this also contributes to the thickening of the functional layer of the endometrium. Okay, let's see here, and so in a drop in progesterone levels along with estrogen, because they both do, as you've already seen in the image there, cause the lining to break down. This is when menses begins, right? So FSH and LH, again, very important as far as knowing what's going on with them. Just giving you more information here. You can look at that on your own. Here you're seeing as far as the terms that we're using to describe the time periods and the areas of the ovarian and uterine cycle, right? So think about this for a moment here. So ovarian cycle, right? So, and really ovarian cycle, we're talking about this follicular phase can vary, between that 14-day, a little bit more, a little bit less, but it's always, right? The second half is always 14 days. So the luteal phase is always 14 days. Follicular phase can vary. As far as the uterine cycle is concerned, so you have here 1 to 5 days. So really, 3 to 5 is 1 to 3 to 5 days for menstruation, for the bleeding period to occur, 6 to 14 days for the proliferative phase, and 15 to 28 days for the actual secretory phase, where we're getting this major thickening and preparation for the fertilized egg to implant. All right, and so here you're seeing as far as this just goes through and shows you as far as the ovarian cycle is concerned. Know that during the period of time of ovulation, your temperature will increase. And this is something that folks that are trying to do methods that they're not using other types of, or they're trying to, let's put it this way, they're trying to determine when exactly, and then there are ovulation predictor kits, right? They're trying to predict when exactly they're ovulating because, folks, it's just at this period of time, this is when you're fertile, right? This is when you can get pregnant. And so, prior to that, later on in that, you're not going to have that opportunity. So, as far as if you really want to have children and want to make sure that, hey, you are making sure that you're patterning what's going on as far as your relations in order to have a baby and such, they'll use these ovulation prediction kits. They'll take their temperature in order to figure out what's going on as far as when ovulation is occurring. Okay. You'll see here, as far as the hormones are concerned, for FSH in green and LH in blue, and you'll see again a spike for both, but dramatic spike for luteinizing hormone, and this is what triggers ovulation. Okay. You'll see here as far as estrogen, right? Estrogen is highest secreted during the first phase, as far as the as far as the proliferative phase, okay? And then you'll see here, as far as the secretory phase, then we have, as far as what's going on, see how much thicker the functional layer of, and you see, what are these? These are the spiral arteries, folks, right? So those will be sloughing off during menses, okay? And you'll see here that progesterone is pro-pregnancy. So this is really what's trying to, produce this nice thick endometrium for implantation of a fertilized egg. Okay, and again, fertilization occurs within the uterine tube. Okay. All right. If pregnancy occurs, the corpus luteum produces hormones that sustain pregnancy. We talked about that as far as kicking out. Well, I didn't know if I said that for this part. No, I probably did not. It is, prior to fertilization, the corpus luteum is enabling the secretion of progesterone, estrogen, and such, right? Absolutely. But then afterwards, if fertilization does occur, corpus luteum continues to produce hormones that will help to sustain the endometrium, okay? And as such, the placenta will then take over at approximately 3 months or so and such. And so let's see, my daughter is very close to this period of time right now. I think she's at 21 weeks. And so it's so exciting. Little girl is coming our way in October, and I'll tell you what date, actually. Let's see. I have it in my calendar here. And so, and I would tell you this also, that know this, that with our family and such, and so let's see here. Yeah, October 15th is her due date. We I as a healthcare provider, and we as just parents that have had kids for many years and been a parent for many years, and had friends that have lost children and such. Thank you, Nicole. We don't take it for granted that a child will make it to the end. Now, I don't want to be pessimistic, but I just want to be realistic in that, you know, we are grateful and thankful so much for this new little baby coming, but you know, there's no guarantees, folks, right? And so, you know, especially in the first trimester, it's really a matter of making sure that things are good and such. But really throughout the whole process and such, it's a matter of we're very anxious, but, you know, trusting that, you know, things will go well. Yeah, Amanda, I agree. There's nothing better than having little ones in the family. So our little girl is she's Anastasia, Anya is a little bit over 2 years, and then Grayson is like 10 months, and so then little Giovanna is what they're going to call her. She's coming in October. So, but again, too, I'm very respectful of people also that have lost little ones, you know, and had issues during sudden infant death syndrome and other situations during pregnancy and such where they're not able to carry to full term. We've had multiple in our family, preemies, born in the low 20s. And wow, it's just remarkable, to be honest, to see that these children can continue to thrive and grow. And thanks to the doctors, the clinicians, and the nurses that work within these departments, and the loving care that they show to the moms and these babies, it brings me a tear to my eye, to be honest, because it's amazing. So do you see like how the impact that you all can have, folks, as far as working in the hospital setting, working in the clinical setting, in offices, in different hospital settings? I just think it's a beautiful thing that if that's your calling and you're able to do this and make an impact into people's lives, and to be able to have these little babies survive, wow, that's just what a beautiful thing, to be honest. I'm just impressed. Give me a moment. I'm going to blow my nose. I apologize. I'm going to shut this off. Yeah, I think it's a wonderful thing, folks. So if that's you, if that's what you're going to focus on and go for, wonderful. You know, I just we've had a lot of very good experiences with those nurses that we had in working in labor and delivery and such, and it's an exciting thing to be a part of, for sure. All right, so here's some other terms and such as far as menarche. So this would be the first occurrence of menses for a young woman, and menopause as far as then ovulation and menstruation cease entirely. So now this can take months in order to get to this point. 46 to 54 considered to have occurred when a whole year has passed without menstruation, without having your period, without having your cycle. So yeah, so very important there as far as knowing those terms, please. And you'll see here also, so we're going to move on to, all right. Yeah, Kyle, cool. Very good. Yeah, and I do believe that yes, it can, Jen. Yeah, you're right. It can. You know, I mean, just like with anything else that goes on, truly, as far as pathology, as far as any type of situations, as far as just even having a cycle that's 28 days or more or less, right? So there can be a lot of variabilities. And know this also, that if genetically this has gone on in your family, you know, in the past with grandparents, grandmothers, mothers, right? Yeah, then these things can get absolutely passed on from one generation to the next. Yeah, without a doubt. So if your mom, if your grandmother, other grandmothers in further generations had an early menopause and such, yes, this can occur for sure. So the term amenorrhea. Now, so what can be contributing factor to this? So many times we'll see this in young women who are very physically active and involved in maybe endurance type sports and such. So as far as running, as far as track and field, these kind of things that are really strenuous type physical activity, very low body fat weight and such, body weight and low fat levels. This can also lead to and contribute to amenorrhea, because of the fact that the body is seeing, hey, you know, and not, this may not be the case, but that, oh, you don't have enough nutrients in your body and your ability to be able to successfully carry a pregnancy, so that your body prevents you from doing that as far as becoming fertile. Yeah. You'll see here as far as okay, let's see what else. Leptin. Okay, leptin is important as far as informs the hypothalamus if energy stores are sufficient to support reproduction. If they're not, see, this also plays this role as far as puberty is concerned and as far as the ability to have your cycle. The mammary glands. Okay, so the mammary glands, modified sweat glands. Quite interesting. You wouldn't think of it that way. As far as these glands actually, there's lobes and lobules within the lobes that will actually produce the milk. Okay, and so it's present within the alveoli of the breast. The breast size, you know, understand that it's not really, the breast size isn't, okay, so then that person has many more lobes than somebody else, right? No, that's not necessarily the case. Primarily, it's more fat deposition, okay, as far as size is concerned. You'll see here this, and this is very important as far as breast cancer is concerned, and getting genetic testing and such. If this is something that's been in your family and such, then the females in the family should get tested in order to see if quite possibly there could be the BRCA1 or BRCA2 gene present that could be an indicator for high risk as far as pregnancy, as far as breast cancer is concerned. And really many people, and you've seen this in the news, I know Angelina Jolie was one of them, but there are other actresses out there also that have been advocates for this, as far as preemptively having a removal of the breast to just prevent the risk for having breast cancer and such. And there's also pretty wild stuff to be done as far as taking care of the removal of the breast tissue and then replacing it with other tissue and such. And I've mentioned, sure, in the past, and probably in AMP1, regarding how they can actually, in Japan, they're doing this on a regular basis. In the United States, I don't know how much we're doing this as of yet. I haven't looked at it for a while, but as far as taking liposuction, taking the fat from your own body, right, as far as the patient is concerned, and then taking those stem cells from the fat and creating a slurry that can be injected into the space where the breast tissue was present, and allowing that space to fill up with, it wouldn't be filling up with breast tissue, but it would be filling up with your own adipose tissue and filling the space where the breast was removed from. That's pretty wild stuff. And so I'm not sure yet how much we're doing that, but there's safe ways in order to work at as far as replacing that tissue that's been removed. Okay, and you'll see here as far as also greater risk of having ovarian cancer if a patient has breast cancer and such. So, all right, so that's it for as far as my reproductive notes. But now let's go to the PowerPoint, and we're going to go here and just do a review regarding structures and such, and then I'm going to go back over to the human bio PowerPoint, because I want to review as far as the STIs are concerned and such. So we'll take a look at that there. So let's first take a look at this sagittal view of the female reproductive anatomy. And what I want to also point out to you is, so you'll see here as far as the urinary bladder, the urethra, right? As far as the external structures are concerned, as far as the labia major and minor, okay? You'll also see here as far as the erectile tissue, right? The clitoris is present there. You'll see here pubic symphysis. And then you'll also see as far as the, let's see here. So this would be the oviduct. This is the fimbriae of the oviduct. You'll see here the ovary and this would be the ovarian ligament right there, okay? Here's the round ligament. So you have these two ligaments here, and then you'll see here the broad ligament will be really right in this area right here, okay? Superior aspect of and helping to maintain the location and the position of the uterus, okay? And so really with this image here, you're not seeing a really good example of, but like, so you'd have the endometrium, you'd have the muscular layer, the myometrium, and then the parametrium. Okay? You have here as far as the cervix is concerned, okay, the cervical canal, cervix, the opening, and you'll have here the vagina, the birth canal, okay, and then you're looking at here as far as the anus, the anal canal, the rectum, okay. All right, and let's go then to. Okay, so I have provided this for you. So this is just giving you a little bit more of an image regarding what's taking place as far as the oocyte is concerned. And then upon expulsion here, the ovum, right, the egg. And here again, the corpus luteum. You're not viewing here the corpus albicans, the white body. Here we go as far as giving you just an A to P view, an anterior to posterior view. And you're seeing here as far as the external and the internal os of the cervical canal of the cervix, okay? You'll see here as far as now, this is giving you a better idea regarding the endometrium, myometrium, the muscular layer. Here would be then, again, too, as far as the endometrium, that functional layer is what's going to be sloughing off during menses. Here you're seeing as far as the ovaries are concerned, and here's the corpus luteum. Let's see here. So suspensory ligament right here, catch and maintaining the position of the ovary. Here you're having the ovarian ligament. So suspensory and ovarian ligament, very important for the positioning of and the maintaining of the position of the ovaries. Okay. And the broad ligament again, right, folks, that this is a very structure that helps to keep and maintain the positioning of the uterus. And here's just giving you another image regarding what's taking place as far as the ovarian cycle. And here we have the corpus albicans being viewed. Okay. Here's upon ovulation, the expulsion of the ovum. Oh, okay. I didn't remember that I had that in there. Okay, very good. So that's from the human biology PowerPoint there. Okay, so very good. And that's just seeing the perineum. Okay. And here's the breast. And so here I wanted to review this and go over this as far as you're seeing here as far as the structures are concerned. And so you're looking here as far as the duct system, right, that will carry the breast milk to the nipple, right, to the areola, to the nipple. And this will then be released upon breast production, upon milk production for a lactating female, okay? And so this would be considered, folks. Remember, we talked about the lobe, the lobules, and and you're not seeing here as far as the little alveoli. These are little, see the little bubbles of tissue, similar to as far as just when you're thinking of the respiratory system, as far as the alveoli, you're thinking of these little, see these little bubbles right here? You can see them better on this side. Those would be the alveoli, which are absolutely involved in production of the breast milk. Okay? And so here, as far as contraception is concerned, as far as the pill, okay? So when you're thinking of the pill, this is a pill that contains both estrogen and progesterone, okay? So it uses synthetic forms of both to suppress the release of follicle stimulating hormone and luteinizing hormone, right? So this is that feedback cycle that you saw in my notes there earlier, okay? So that's what the pill does as far as it contains both. Now the mini pill will contain what? It'll contain just progesterone, okay? Prevents the maturation of the egg and its release upon ovulation, okay? The mini pill, right, the progesterone-only pill contains the synthetic progesterone, okay? May prevent ovulation, thickening of the cervical mucus, making it difficult for, right, because really you want that mucus to be thin in order for the sperm to pass through and be able to reach the ovum as far as present within the uterine tube, okay? Morning after pill, this is hormones taken within the first few days after unprotected intercourse, 2 different types, and can help to can combine with estrogen and progesterone and prevent the actual implantation. You'll see here as far as the STDs are concerned. So, yeah, so all right, you know what I did? All right, good. All right, very good. So then I provided that other one. You can look at that other human bio, but here I did transfer it over into. I forgot that I did that. So, all right, very good. So you'll see here as far as chlamydia, one of the very prevalent, very at a high percentage, and I don't know the numbers offhand, present within the United States, higher than in other levels of the world. Caused by a bacterium. And if it's caused by a bacterium, that means that we can use antibiotics in order to treat it, okay? So this can be treated. Can exhibit, and this is the problem here, folks, and I want to point this out to you all, that it can exhibit no outward signs of infection. So you can be asymptomatic and still suffer from this chlamydial infection, and this can in turn if it's not untreated, can enter deeper into the reproductive tract and cause issues like pelvic inflammatory disease, which in turn, right? So if chlamydia, if gonorrhea, if they're not treated, they can, the infection can go deeper into the reproductive tract and it can lead to infertility. And it's one of the leading causes of infertility among young women. It's terrible, sad, because, you know, maybe early on in your life, you're not really interested in getting pregnant and having children, but as you grow older, maybe that might be an option for you. And sad if that option has been taken away as a result of suffering with an infection that led to PID. Gonorrhea, also a bacterium, okay? So may have no symptoms at first, but again, too, may have symptoms and the symptoms go away, right? You know, like there's issues where this has to be, if you're active and you've had multiple partners or you're switching to another partner, folks, you got to get tested. You really do, because you got to protect yourself and you got to protect others for sure. Antibiotics can kill strains that are not antibiotic resistant, and that's the problem. So yes, with chlamydia, yes, with gonorrhea, can there be strains that are antibiotic resistant and can be a problem, in particular with gonorrhea? Yes. Syphilis also bacterium, right? So if it's a bacterium, can there be, these are microorganisms that can be treated with antibiotics. But again, too, finding out early on, diagnosis and treatment, very important. And with syphilis in particular, this can, the primary stage, you'll have an ulcer, this is called a chancre, and it can be present, and then it can go away. You're like, oh, I'm cured. I didn't need to have any type of interaction as far as any type of antibiotics and such. And no, that's not the case. It just, what happens is then it'll calm down. It can go progress into the secondary stage. Lesions and a rash can form. And this tertiary stage, if untreated, folks, this can then lead to major neurological damage and such, and really be very bad as far as it's a catastrophic outcome for tertiary syphilis untreated. Okay, so viruses. So genital herpes. So you'll have here as far as caused by a virus, lifelong infection, extremely contagious. Okay, type 1, type 2, type 1, we're talking about, you know, more oral situation, eyes. Type 2, we're talking about the genitals regarding. And again, folks, this is something that really, if you have an active infection, you know, if you're having unprotected sex, this is not a good thing, because then you'll pass it on to someone else. So HPV, right? One form of human papillomavirus causes genital warts, and this certain kinds can, most cases of invasive cervical cancer, so can cause cervical cancer, also anal and oral cancers and such. So this is not a good thing, and this can really be something that, so there's a vaccine present, recommended for boys and girls before they become sexually active. Yes, he did. You're right, Deb. He did. Al Capone did die as a result of syphilis. I would imagine that it progressed into tertiary syphilis and wasn't treated and such. Yeah. Hepatitis, also viral related, so can be sexually transmitted. So hepatitis B in particular, transmitted in blood and body fluids, okay? Far more contagious than HIV, attacks the liver, leading to scar tissue, cirrhosis, cancer, STIs as far as hepatitis C also causing cirrhosis, causing scar formation. Cancer can also occur. You'll see here as far as other like parasites and such. So, and then we'll look at trichomoniasis. Yeah. So first, the parasites. So lice are concerned, also known as crabs and such. This is not damaging per se, but can be very uncomfortable, I'm sure. And as far as candidiasis, as far as a yeast infection, and very common and can be treated. As far as antifungal medication. And then trichomoniasis. Now, this is a protozoan parasite causing severe vaginal inflammation. This can be very uncomfortable, and antibiotics need to be treated for both partners as far as that can, and as far as also the yeast infection also can be gone back and forth between male and different partners and such. As far as condom use and such, know that none of these things, folks, none of these are 100% effective. You need to know that, right? And so again, too, if you're having other type of relations where other parts of your body are involved and they're not protected, right, this can be issues. So, know that just because something is in a different area doesn't mean that, and we all know this, right? But to be able to educate and help people in our family and our children to understand this better, information is important, and information is power. So very important. Look at this here. So avoid abusing alcohol and drugs. Now you would say to yourself, well, that makes sense, right? But understand that. And I, early on in my practice, I had a person work for me, and working part-time, and this patient ended up getting involved with drugs in particular, and as a result, risky behavior and getting pregnant by multiple partners. It was very, very sad. Yeah, very, very rough stuff, and leading to bad stuff, right? So, alcohol and drug abuse, we're very familiar with this, folks, and it's a sad thing that's been a part of our society. And maybe you might be involved in working in a treatment center. I don't know. That might be something that you're thinking about doing and such. And so more power to you if that's what you really feel like that's your calling and you're able to do that. Yeah, great stuff. Be able to help people in that way. And let's see here. Okay. Yeah, so the zygote, right? So you'll see here as far as egg fertilization, 12 to 24 hours after ovulation. When it's fertilized, it becomes the zygote, that fertilized egg, okay? Moves down the uterine tube into the uterus and embeds into the endometrium. Very important. You'll see here as far as, I'm not asking you to memorize this or know this, folks, but know that it's the ectoderm that really contains the nervous system development, okay, as far as the germ layers are concerned of the embryo, okay? Mesoderm for the muscles and bones, and the endoderm, this would be the lining of the organs and the glands and such, okay? The amnion, this is containing the fluid-filled sac. The amniotic fluid is present within, attached to the embryo by the umbilical cord, protective and covering of the maturing baby. You'll see here as far as the term parturition. This is a term that we use for childbirth. I'd like to show you as far as, let's see here. So let's go to, okay. And so this just, I know for us and for my family and such, and so just to be able to see Now I'm not seeing the size here. Let me see. Okay, so here we go. All right. And move this out of the way. Here we go. So you'll see here as far as, it's not showing you size and such, but if you can see, folks, that the beating heart begins within the first month, folks, okay? A little bit after the first month, after the 4 weeks or so, you have a beating heart. And see the changes that take place as far as what this little developing child can look like here. I'm not getting a good image here. I wanted to have like something that has an image to show you regarding size as far as giving you an actual size. I will find that and share that with you. I don't take your time. Yeah, I had it and I don't see it. All right, I'll get that to you, and I want to show that to you and share that with you all. But you'll see here, as far as this last image that I have for you in the PowerPoint, it's just showing you as far as the germ layers, okay, of what's taking place. And again, knowing that ectoderm develops the skin, develops the nervous system, the mesoderm again, the muscles and such, and the endoderm as far as the lining of the organs and such. Okay. All right, so let's stop